Hello friends, today's video is about myocardial infarction. From report of myocardial infarction patient. This is a video of the transport to the hospital. I hope this video will help you understand the treatment process of patient with myocardial infarction and risk of it. Good, then let's start the video right away. Let's go!
Emergency patient occurrence. Emergency patient occurrence. Occurrence of patients complaining of chest pain. Tugime University. Tugime Fire Department's first aid team should not return and immediately go to the field. Occurrence of patients complaining of chest pain. Tugime University. Tugime Fire Department's first aid team should not return and immediately go to the field.
I'm a Kime Fire Department paramedic. Where are you most inconvenient?
I have a bad pain in my chest.
Can you explain where the chest hurt now?
Feels like something is pricking my chest.
When did the chest pain start?
About 20 minutes ago.
Are you able to move?
Yes.
I'm going as soon as possible, so don't worry. Please wait.
Okay.
The patient has pain in the middle of his chest since 20 minutes ago. He is able to move.
Okay, please evaluate the vital sign when you get to the site. And Jiun, please report on the patient's history. And Changmin, please take the defibrillator.
I will evaluate the patient's vital sign when we get to the site.
I will report on the patient history.
Okay, I will take the defibrillator.
We are going in. Where does it bother you the most?
My chest hurts.
Where in the chest does it hurt?
It feels like stabbing in the middle.
Do you have pain anywhere else?
I'm just a little bit dizzy.
When did the pain start?
I think it's been about 25 minutes.
Have you experienced this before?
No, it's the first time.
What number would you say if the pain was from 1 to 10?
About 6.
The patient's vital sign evaluation results are BP 110, 17, PR 19, RI 25, saturation 91, PT 36.5.
Check. Do you have any disease?
I have hypertension and diabetes.
Since when do you have with hypertension and diabetes?
I was diagnosed with hypertension 5 years ago and diabetes 3 years ago.
Are you taking any medicine?
Yes, I take the hypertension and diabetes medicine.
Okay.
Yunju, can you check the patient's BST and Changmi please monitor?
Okay, I will check the PST. We will conduct a test to check the sugar level in the patient's blood. It can be a little tingling.
Okay, hurry up, this hurts so much.
BST is 125.
When did you eat the last time?
Around 8:30 in the morning.
Check.
Okay, I will monitor. I'm going to measure the ECG to check your heart pressure. Can I remove the top for ECG measurement?
Yes.
Please take off any jelly if you have any.
Okay.
Patient ECG read attachment has been completed.
I am going to analyze ECG rhythm. Please do not talk or move for one moment. Patient is showing ST elevation. It leads to suspecting myocardial infarction. Going to prepare transport right away.
Preparing transport.
Wait, doctor, the patient's chest hurts, so why do they do nothing and transfer them to the hospital?
That's good. That's a very good question. I will briefly explain MI. The heart is largely cardiovascular, in other words. It receives oxygen and nutrients from the coronary arteries and is active. However, if any one of the three coronary arteries is acutely blocked due to thrombosis or rapid constriction of blood vessels, myocardial infarction is a situation in which the tissue or cell of the heart must die, as the supply of oxygen and nutrients to or part of the heart rapidly decreases. The most common clinical symptom of myocardial infarction is chest pain. To determine if the chest pain is due to a myocardial infarction, an ECG should be performed. According to the ECG results, myocardial infarction is divided into two types, classified as STEMI or non-STEMI, depending on whether the ST segment is elevated. STEMI with an elevated ST segment is a really urgent situation. In patients with myocardial infarction, early diagnosis and early treatment often determine the patient's survival. So the key point here is to quickly transport the patient and quickly perform PCI. It's good. Let's continue watching the video.
This is IM paramedic from Kimei final department. Can you move a patient who is showing MI symptom?
Yes, how long will you take to get here?
Maybe about 15 minutes.
Okay, please transport SF.
Yonju, please check the patient's vital sign every 5 minutes.
Okay, we check the patient's vital sign every 5 minutes. The patient's vital signs show BP 116, PR 19, RN 25, saturation 19, PT 36.6.
Changmin, please switch to 12 lead ECG.
Okay, switching to 12 lead ECG.
In the case of myocardial infarction, it can be divided into anterior wall myocardial infarction, inferior wall myocardial infarction, and lateral wall myocardial infarction. To find out where myocardial infarction occurs, I needed to switch the ECG to 12 lead. If you see an elevation of the ST segment in the V1, V2, V3, and V4 lead, you may suspect an anterior wall myocardial infarction. Inferior wall myocardial infarction if there is an elevation in lead 2, lead 3, AVM. If you see an elevation of the ST segment in lead 1, AVM, V5, and V6, you may suspect a lateral wall myocardial infarction. Also seen ventricular fibrillation can occur in patients with myocardial infarction. It is good to keep monitoring. If a myocardial infarction is suspected, it can be said that it is necessary to measure a 12-lead ECG. Okay, keep going.
As a result from 12-lead ECG showing ST signal delebilation at lead 2, lead 3, AVA.
Suspecting imperial myocardial infarction must move the patient quickly.
The patient is saying he has stabbing pain in the middle of the chest. He has hypertension and diabetes. His vital sign and BP 116, PR 19, oral 35, saturation 19, BT 36.6. He is shown ST elevation at lead 2, lead 3, AVF as a result of ECG.
Please secure the patient's vein. Full drop normal saline 1 liter, administer NTG sublingual, and administer oxygen 5 liter through the nasal cannula. Please move as fast as you can.
Got it.
How is your chest pain?
It is getting worse.
Try to breathe deep and slow. We are going to transport you as fast as we can. June, please administer oxygen to the patient's 5 liters from the nasal cannula.
Administering oxygen 5 liters through the nasal cannula.
Yonju, please secure the patient's vein and pull down normal saline 1 liter.
Securing vein and full dropping normal saline 1 liter.
Chanmin, please administer NTG sublingual.
I will put the pill under the patient's tongue, so don't chew it and don't swallow it.
Okay.
How old are you and what's your name?
My name is Uwan Kim. I am 45 years old.
Do you have any allergy?
No, not that I know.
What is your height and weight?
178 centimeter and 78 kilogram.
Okay.
The patient's vital sign elevation is BP 117, PR 18, RR 18, saturation 95, BT 36.6.
Check. How is your chest pain now?
I feel much better.
Okay, don't worry. I will be arriving at the hospital soon.
45 years old me, he was saying he had pain in the middle of his chest. His cold sweat, cold skin, and chest pain start over 40 minutes ago. He has hypertension and diabetes. The primary vital sign were BP 117, PR 19, or 25, saturation 91, BT 36.5, and the BSD 125. The last meal is around 8:30 in the morning. From the ECG, the short ST elevation is lead 2, lead 3. Every app, we administer 5 liter oxygen for the normal saline 1 liter. And after administers NTG, sublingual the chest pain was people reaching the highest period the vital sign was BP 170, PR 80, R 18, saturation 95, PT 76.6, which got relatively fatty.
This video you have watched so far is a process dealing with a myocardial infarction patient. It can happen to anyone. For myocardial infarction patient, the most important thing is to report it quickly. Don't be afraid to report. We will find you wherever you are. Thank you for watching the video. Bye.